Welcome back to JESH E-Nursing. I'm Shoba Jayakumar here, one of the nursing job exam education specialist. In this video, we are going to see the continuation of oncology nursing MCQs questions 28 to 55. This presentation, we are going to see some of the questions and answers, rational, pathophysiology, concept, nursing interventions, management from oncology nursing. All right, let us move on to the questions. Question number 28. Which of the following is the reason to perform a spinal tap on a client newly diagnosed with leukemia? Once the client is diagnosed with leukemia, what is the stage we need to identify, and also whether it is involved into the central nervous system also we need to identify. If we wanted to identify whether it is involved into the central nervous system, we need to go for lumbar puncture. So cerebrospinal fluid will be given the diagnosis for whether it is involved into the central nervous system. So we need to perform a spinal tap. Spinal tap is a performed process the central nervous system infiltration. It wouldn't be done to decrease the intracranial pressure, nor does it aid in the classification of the leukemia. Spinal taps can result in brainstem herniation in case of increased ICP, intracellular intracranial pressure. Question number 29. Which of the following tests in the performed on a client with leukemia before initiation of therapy to evaluate the child's ability to metabolize the chemotherapeutic agents? Answer is 2. Liver function studies. Any patient is getting chemotherapy, before going to the chemotherapy, the eligibility we need to check. So the eligibility check is very important. That means the body can able to metabolize, or the body can tolerate the medicines, or the side effects are there, or the liver can able to metabolize, or kidney can eliminate the waste products, all those things. And CBC, whether the CBC, complete blood count, is normal, whether it is decreased or not. These all the test will be done before going for the chemotherapy treatment. Once the patient is eligible to receive the chemotherapy medicine, only the chemotherapy medicines will be administered. So liver function test is very important. Whether the liver can be able to function properly, need to identify. Liver and kidney function studies are done before the initiation of chemotherapy to evaluate the child's ability to metabolize the chemotherapeutic agent. CBC is also performed to assess for anemia and white blood cells counts. How much is the counts level, blood cellular elements counts, it's necessary to find out. A peripheral blood smear is done to assess the maturity and morphology of the red blood cells. The pathology of the blood cells to identify peripheral blood will be done. A lumbar puncture is performed whether the disease is involved or infiltrated into the central nervous system. This is the reason these all the tests will be done. Okay. Question number 30. Which of the following immunization should not be given to a 4-month-old siblings of a client with leukemia? So, always you remember immunizations according to the scale, according to the immunization schedule, we can give it to the children, except immunosuppressive. That the baby is under acute lymphocytic leukemia, the baby is low immune than the normal child. So once they give the oral polio vaccine, this is a live attenuated vaccines. If we give this oral polio vaccine, it is excreted in the stool. The excreted virus can be communicated to the immunosuppressed child, resulting in an overwhelming infection. So inactivated polio vaccine would be indicated because it is not a live virus and wouldn't be pose the threat of infection, and other vaccines also not contraindicated. DTP, Hib vaccine and hepatitis vaccines can be given according to the recommended schedule. Next question, question number 31. Which of the following medications usually is given to a client with leukemia as prophylaxis agent? Falciparum corneae pneumonia. So here the answer is Bactrim. The most frequent cause of death of leukemia is the leukemia or any kind of people who are taking chemotherapy medicine, any kind of cancer patients, most probably the death or the death is mostly happen because of infection. So the prophylaxis agent we need to give to prevent pneumonia. So Bactrim is the drug of choice here. Oral nystatin suspension will be given for some of the oral candidate. These conditions will be given. Prednisolone is an corticosteroid, so it is not advisable here. Vincristin is an antineoplastic agent. It is one of the medicine for the chemotherapy. So answer is A. As a prophylactic agent, P. caroni pneumonia continues low doses of cotrimoxazole, that is Bactrim, are frequently prescribed. In which of the following diseases would bone marrow transplantation not to be indicated in a newly diagnosed client? Bone marrow transplantation is indicated for bone marrow disorders. So all of these are bone marrow disorders, but acute lymphocytic leukemia is a blast cell disorder. Here the blast cells are affected, not mature cells. Mature cells are chronic. Lymphocytic leukemia, if you divided, if you going for the types, there are 4 types: acute lymphocytic leukemia, chronic lymphocytic leukemia, acute myelogenous leukemia, and chronic myelogenous leukemia. Acute lymphocytic leukemia, the disorders will be there in the immature cells, that is blast cells. Chronic conditions will be, the disorder will be in mature cells. So here the acute lymphocytic cells are newly diagnosed cells. This acute lymphocytic leukemia is cure is possible. 80% prognosis is good. Other conditions: chronic myeloid leukemia, severe aplastic anemia, severe combined immunodeficiency. These are chronic bone marrow transplantation. Bone marrow is affected severely, so bone marrow transplantation will be done after chemotherapy. The first episode of acute lymphocytic leukemia, conventional therapy is the superior to bone marrow transplantation. So the treatment will be given for chemotherapy will be given. In severe combined immunodeficiency and in severe aplastic anemia, bone marrow transplantation has been employed to replace abnormal stem cells with the healthy cells from the donor's marrow. In myeloid leukemia, bone marrow transplantation is done after chemotherapy to infuse healthy marrow cells and to replace marrow stem cells ablated during chemotherapy. Then question number 33. Which of the following treatment measures should be implemented for a child with leukemia who has been exposed to chickenpox? Here the answer is 4. Varicella vaccine, which will be given within 72 hours of exposure. Varicella is a lethal organism to a client with leukemia. So varicella is given within 72 hours once they exposed with the chickenpox. May favorable alter the course of the disease. Giving the vaccine is the onset of symptoms wouldn't be likely decrease the severity of the illness. Acyclovir is the drug of choice. May be given if the child develops the disease but not if child has been exposed. Next question. Nausea and vomiting are common adverse effect of radiation and chemotherapy. Which should the nurse administer antiemetics? When should a nurse administer antiemetics? So, nausea and vomiting is expected common side effect. Always, before giving the chemotherapy, 30 minutes before initiation of therapy, we must give antiemetics. The most beneficial given before the onset of nausea and vomiting. To calculate optimum time for administration, the first dose is given 30 minutes to 1 hour before nausea is expected. Then every 2, 4 and 6 hours, approximately 24 hours after the chemotherapy will be given. If the antiemetics was given with the medication or after the medication, it could lose its maximum effectiveness when need. Next question, parents of pediatric clients who undergo irradiation involving the central nervous system should be warned about post-irradiation somnolence. When does this neurological syndrome usually occurs? Answer is A, within 5 to 8 weeks. Post-irradiation somnolence may develop 5 to 8 weeks after CNS irradiation and may last 3 to 15 days. It's characterized by somnolence with or without fever, anorexia, nausea, and vomiting. Although the syndrome is not thought to be clinically significant, parents should be prepared to expect such symptoms and encourage the client needed rest. Next question, question number 36. The nurse is instructing the client to perform a testicular self-examination. The nurse tells the client to examine the testicles. Examine the testicle after a shower. The best time for the examination is after a shower. The testicular self-examination recommended monthly after a warm shower or bath when the scrotal skin is relaxed. Using both hands with the fingers under the scrotum and the thumbs on the top, the client should gently roll the testicles, feeling of any lumps. Alright. Next question, question number 37. The community nurse is conducting a health promotion program at a local school and is discussing the risk factors associated with cancer. Which of the following, if identified by the client as a risk factor, indicates a need for further instruction? Here we need to find out the wrong answer. Other three answers will be correct. So here wrong answer is low fat and high fiber diet. So low fat and high fiber diet is identified. It is the ideal diet for cancer. So viral factors and stress exposure to radiation, these are the risk factors of cancer. So once the person is exposed to the viral factors, those people are risk for getting cancer. When the person is patient is experiencing cancer, if they have stress, it will trigger the cancer. Then exposure to radiation is also one of the risk factors for cancer. Next question, question number 38. The client with cancer is receiving chemotherapy and develops thrombocytopenia. The nurse identifies which intervention has the highest priority of the nursing care plan. Here, all the answers may be correct, but the highest priority is the keyword. We need to select the highest priority. Yeah, the answer is 3. Monitoring the platelet count. So, thrombocytopenia is there. The platelet counts are low. So, once the patient is getting chemotherapy, all 3 blood cells count will be decreased. I told you in the previous video, pancytopenia with the common side effects of the chemotherapy. So, patient will be anemic, white blood cells count will be decreased, even platelet counts will be decreased. So, thrombocytopenic patients, we need to monitor bleeding tendencies are there or not. The next question, a client is diagnosed with multiple myeloma. The client asks the nurse about the diagnosis. The nurse bases the responses on which of the following descriptions of this disorder? Answer is malignant proliferation of plasma cells and tumors within the bone. The previous video we have seen what is multiple myeloma and how it is affects, what are the symptoms will be present. All those we have seen. Multiple myeloma is a plasma cell disorder. So the plasma cells will be accumulated, immature type of plasma cells will be accumulated in the bone marrow, and other cells will be not adequately it will be produced because of the placement of non immature cells accumulated in the bone marrow. Multiple myeloma is a beta cell neoplastic condition characterized by abnormal malignant proliferation of plasma cells and accumulation of mature plasma cells in the bone marrow. Question number 40. The nurse is receiving the laboratory results of a client diagnosed with multiple myeloma. Which of the following would the nurse expect to note specifically in this disorder? Here the answer is 3. Increased calcium levels. Multiple myeloma, if the patient is having multiple myeloma, the bone will be affected. The bone marrow will be affected. So once the bone is destroyed, the calcium will be released into the blood circulation. In the blood, high levels of calcium will be there. The bone will be destroyed. So the answer here is increased calcium levels. Patient will be because of increased number of plasma cells in the bone marrow, anemia will be there, hypercalcemia caused by the release of calcium from the deteriorating bone marrow. Next question, the nurse is developing a plan of care for the client with multiple myeloma. The nurse include which priority intervention in the plan of care? Answer is 2. Encouraging fluid is essential for this condition because multiple myeloma, the patients will be having hypercalcemia. So the osmolarity of the blood will be, it is increased. So blood will not be moved freely. So we need to encourage the patient to give more fluid. So it will help to uh, flow. The kidney can able to eliminate the waste. Hypercalcemia caused by bone destruction is a priority concern in the client with multiple myeloma. The nurse should administer the fluids in the adequate amounts to maintain intake and output at least 1.5 to 2 liters a day. Client requires about 3 liters of fluid per day. The fluid is needed not only to dilate the calcium overload but also to prevent protein from precipitating in renal tubules. Next question, question number 42. The oncology nurse specialist provide an education session to nursing staff regarding the characteristics of Hodgkin's disease. The nurse determines that the further education is needed if a nursing staff member states that which of the following is characteristics of the disease. Hodgkin's disease, when you are discussing, immediately you should remember it's a gigantic, abnormal kind of big tissue. So it's called as Reed-Sternberg tissue. So Hodgkin's disease is a disorder of young adults. It's characterized by Reed-Sternberg cells. It occurs most often in the older client. Here the question is, nurse determines that the further education is needed. So you need to select wrong answer from this question. This is the keyword. So answer here is, wrong answer is C. Correct answers are Hodgkin's disease is presence of Reed-Sternberg cells. Then second, it is involved in the lymph nodes, spleen and liver. The prognosis depends on the stages of the disease. So all these 3 points are correct related to Hodgkin's disease. Wrong statement is C. Question number 43. The nurse is receiving the laboratory results of a client receiving chemotherapy. The platelet count is 10,000 cells per minute. Based on the laboratory value, the priority nursing assessment. So I told you before, chemotherapy, once the patient is going for chemotherapy, receiving chemotherapy, the patient's pancytopenia will be developed, all three cells, and patient will become anemic and WBC comes low, and platelet will be comes low, thrombocytopenia will be there. Once the count comes to 10,000, there will be central nervous system involvement will be there. So closely we need to monitor. Assess the level of consciousness is very important, because whether it is involved into the central nervous system, it is you need to identify. That's a priority assessment. Also, hemorrhage is the possible in the central nervous system once it is comes to 10,000 level. Next question, the nurse is caring for a client following a modified radical mastectomy. Which assessment findings would indicate that the client is experiencing a complication related to this surgery? The complication of radical mastectomy is edema, arm edema on the operative site. Arm edema on the operative site, that is lymphedema, is a complication of the complication following mastectomy and can occur immediately post-operatively or may occur months or even after the surgery. Then question number 45. A nurse is providing education in the community setting about general measures to avoid excessive sun exposure. Which of the following recommendation is appropriate? Answer here is 4. Apply sunscreen with a sun protection factor of 15 or more before sun exposure is the answer. It should be applied before sun exposure and reapplied after being in the water. Peak sun exposure usually occurs 10 to 2 p.m. Tightly woven clothing, protective hats and sunglasses are recommended to decrease sun exposure. Question number 46. Which of the following nursing interventions would be the most helpful in making the respiratory effort of the client with metastatic lung cancer more efficient? The answer is 3. Teaching and encourage pursed lip breathing. For clients with obstructive versus restrictive disorders, extending exhalation through pursed lips breathing will make respiratory effort more efficient. Usually the position is upright position is possible, leaning slightly forward to allow greater lung expansion. Teaching diaphragmatic breathing techniques will be more helpful to the client with a restrictive disorders. Administering cough suppressants will not helpful for these conditions. Nurse is teaching a 17-year-old client and a client's family about what to expect with high-dose chemotherapy and effect of neutropenia. What should the nurse teach as the most reliable early indicator of infection in the neutropenic client? Here the answer is 1. Fever. Neutropenic patients, we need to monitor fever, whether any signs of infection we need to identify. High dose of chemotherapy. Fever is an early sign of requiring clinical intervention to identify potential causes. Next question number 48. A 58-year-old man is going to have chemotherapy for lung cancer. He asked the nurse how the chemotherapeutic drugs will work. Most accurate explanation the nurse can give is which of the following? The answer is 1. Chemotherapy affect all rapid dividing cells. Chemotherapy function is it will identify non-dividing cells and faster growing cells and it will kill. This is the function of chemotherapy. So there are many mechanisms actions for chemotherapeutic agents but affect the rapidly dividing cells, both cancerous and non-cancerous. That's the reason it is affecting non-cancerous cells also. That's the reason patient after chemotherapy going for pancytopenia. Cancer cells are characterized by rapid cell division. Chemotherapy slows the cell division. Not all chemotherapeutic agents affects molecular structure. All cells are susceptible to drug toxins, but not all chemotherapeutic agents are toxins. When caring for a client with a central nervous line, central venous line. Which of the following nursing actions should be implemented in the plan of care for a chemotherapy administration? Select all that apply. Answer is 1, 2, 4, 5. First one is verify the patency of the line by the presence of a blood return at a regular interval. The second is inspect the insertion site for swelling, erythema or drainage. The next is 4 and 5. If unable to aspirate blood, reposition the client and encourage the client to cough. Then last step is contact the healthcare provider about verifying the placement if the status is questionable. Next question number 50. A client with stomach cancer is admitted to the oncology unit after vomiting for 3 days. Physical assessment findings include irregular pulse, muscle twisting, and complaints of prickling sensations in the fingers and hands. Laboratory results include a potassium level of 2.9, pH of 7.45, and bicarbonate levels are 29. The client is experiencing what alkalosis or acidosis or metabolic acidosis. Here bicarbonate levels are increased or not, the pH is increased or not, we need to identify. Here the answer is metabolic alkalosis. So acidosis means pH will be decreased, here the pH is increased, so it is 7.45, so it is increased, so it is alkalosis is confirmed. The bicarbonate level also increased, so it is the indication of metabolic alkalosis. The client is experiencing metabolic alkalosis caused by loss of hydrogen and chloride ions from excessive vomiting. This is shown by pH of 7.46 and elevated bicarbonate level of 29. Next, question number 51. A 32-year-old woman meets with the nurse on her first office visit since undergoing a left mastectomy. When asked how she is doing, the woman states her appetite is still not good. She is not getting much sleep because she doesn't go to bed until her husband is asleep, and she is really anxious to go back to work. Which of the following nursing intervention should the nurse explore to support the client's current needs? So this kind of questions, it looks like depressive. Patient is depressive. So all kind of depressive people, we need to encourage them to talk. We should be a good listener rather than teller. So we need to ask open-ended questions. They have to able to answer. So answer is D. Ask open-ended questions about sexuality issues related to her mastectomy is the answer. Next, question number 52. One of the most serious blood coagulation complications for individual with cancer and for those undergoing cancer treatment is DIC, designated intravascular coagulation. The most common cause of this bleeding disorder is sepsis. Why this is the common? This is a common cause of this bleeding. What will be happen once the person is having DIC? Here, once the person is having this disseminated intravascular coagulation disorder, the factor 12 will be affected. So, bacterial endotoxins released from the gram-negative bacteria activate the H-man factor or coagulation factor 12 will be affected. This factor inhibits coagulation via the intrinsic pathway of homeostasis as well as stimulating fibrinolysis. So, liver diseases can cause multiple bleeding abnormalities resulting in chronic subclinic DIC. However, sepsis is the most common cause. Next question number 53. A pneumonectomy is a surgical procedure sometimes indicated for the treatment of non-small cell lung cancer. A pneumonectomy is involved removal of entire lung field. A small or wedge-shaped lung surface is the removal of section of the lung tissue. A lobectomy is removal of one lobe. Removal of one or more segment is called as segment of lung lobe is called as partial lobectomy. Next question, question number 54. A 36-year-old man with a lymphoma present with the signs of impending septic shock 9 days after chemotherapy. The nurse could expect which of the following to be present? Answer is 2. Low-grade fever, chills, and tachycardia. Septic shock. So patient is going for septic shock. Any microorganisms entered into the blood circulation, patient will go for septic shock. So after 9 days, or else the 9th day, because of chemotherapy, patient will go for the pancytopenia. So this stage comes after 9 days. The blood cellular elements will comes to very low. Red blood cells count will comes to very low, and white blood cells counts will come slow, and platelet counts comes to very low level. So shock is the expected side effects. So the 9 days after the chemotherapy, one would expect the client to be immunocompromised. The clinical signs of shock reflect changes in the cardiac function, vascular resistance, cellular metabolism, and capillary permeability. Low-grade fever, tachycardia, and flushing may be the signs of shock. The client with impending signs of shock may not have decreased oxygen saturation. Oliguria and hypotension are the late sign of shock. So, initial symptoms are low-grade fever, tachycardia, and flushing. The last question, question number 55. Which of the following represents the most appropriate nursing interventions for a client with pruritus caused by cancer or the treatment? The answer is 4. Medicated cool baths. Nursing interventions to decrease discomfort of the pruritus include those that prevent vasodilation, decrease anxiety, and maintain skin integrity and hydration. Medicated baths with salicylic acid or colloidal oatmeal can be soothing as a temporary relief. The use of antihistamines or topical steroids depends on the cause of pruritus, and these agents should be used with caution. Using silk sheet is not a practical intervention for hospitalized clients with pruritus. This is end of the video. I hope you have understood my explanations about oncology nursing. If you like my presentation, please like and share my video. Thank you.